So I'm super passionate about this project that TLC is taking on, the Community Health Needs Assessment and Impact Survey. And why am I so excited about something that has such a long name? It's really simple because it makes a lot of sense. And here's how I see it. The biggest thing that many of us struggle with is simply feeling alone. Individuals with BFRBs, we often isolate ourselves, we hide, we do everything we can to not be found out, even from people that we love. And equally isolated are parents, who maybe your children have confided in you, but where do you turn to? How do you get support? How do you find answers? A lot of us as parents, we don't necessarily tell a lot of our extended family or our friends what's going on with our kids. So we're left feeling really isolated and alone in helping to support them. And then providers, as a provider, I know for myself, it was really overwhelming trying to wade through research, trying to figure out what are the best proven strategies for helping to support individuals to find more freedom from these behaviors. So as a provider, it can feel very isolating. And then there's the researchers who are working feverishly trying to find answers, trying to learn more about what's behind these behaviors, what can help to have more freedom, but they're often isolated from all the rest of us. And so this is why I'm so passionate about this survey, because it is this opportunity for us to come together underneath this space of TLC Foundation and just simply be able to listen to each other, to connect to each other. It's this opportunity for us to come out of our own isolated space and be able to have all of our voices heard, and in an organized way, be able to disperse this information in a way that'll really make a difference. So there are 3 sections in this survey. The first will go through the history of your behaviors. The second will go through the impact they're having on your life. And the third will be the support you've received and wished for. And you can take this survey as an adult with BFRBs, as a minor, so someone under 18. We ask that you have a parent or a caregiver with you to take the survey. And there's also a section for parents. So we welcome all of you to be able to participate in this important work. So first we'll go through the history of your BFRBs. How are they showing up for you? So we'll ask you about when did they begin and which behaviors are you experiencing and how much are they affecting you? How much time per day are you spending on them? And what makes your urges worse? And so what's so neat about this is we're going to be able to take this information and see globally from all of your voices, what are the things that we see that are consistent between, we all have our own unique things, but we also have a lot of things that we share. And so we're going to be able to see this really clearly in doing this research. The second category is the impact. How are these behaviors impacting your life? And so we explore 8 different sectors of impact. And so now if any of you are also having your head upside down like I am, following this turn, we go through education and work and family, social, your relationships. How is it impacting your physical health, your financial health, your mental health? These are really important parameters to be able to measure and quantify so that we can then share this with the world and be able to get funding, be able to get support, be able to shout it from the rooftops that these behaviors are important to pay attention to. So you'll have an opportunity. This survey will take you about 15 minutes if you just kind of breeze through it and answer. But we've also given you opportunities to be able to expand, to share in your own words some of your own unique experiences. So I really want to invite you to dive into this with as much depth as feels meaningful to you. You'll have an opportunity to rate the support you've received from teachers, from medical providers, from lifestyle practitioners. You'll be able to tell us what have been your biggest barriers to getting the support that you need, so we can really better understand that, so we can help to open up avenues to support. And this is one of my favorite aspects, is this idea of crowd healing. So we don't all need to figure this out on our own. So what's so neat is if many of us can take this together, we can share with each other What's worked? What have you tried? Who have you seen? What's worked? What hasn't? And we can start looking for trends. We can start to see the things that rise to the top that are worth paying attention to, the things that are helping those of us with these behaviors to find some relief. And so the last aspect of this survey is for you to be able to have a voice in TLC's future. You can rate and say what's most important to you. Where do you think TLC should be reaching out? And the very last question, you'll have an opportunity just to dream big. You know, if you just had a blue sky opportunity to say, what would you love to see this organization grow into? What does that look like for you? And so you'll receive customized results after the end of this quiz. You'll be able to take this on your desktop, but it's also really phone friendly, so it's super easy to take. And you'll receive some customized results that will link to TLC's brand new website. If you haven't checked it out yet, it's gorgeous, bfrb.org. And so depending on the answers in your survey, it's going to customize and give you some resources and suggestions for the behavior that's impacting you most right now. And so from this information, this is what's most important. So there's all kinds of things that can happen, but one very tangible thing is that TLC can create impact reports. How are these behaviors impacting adults? How are they impacting kids? How are they impacting families? So the data from these reports will be so vital in being able to close system gaps, to be able to build better resources to meet your needs. TLC will use this information to be able to grow awareness, to be able to shout it from the mountaintops that these behaviors deserve attention, they deserve research. They'll be able to reach out and be able to open up new avenues for funding for local, state, and federal grants. They'll be able to educate public policy makers, community leaders. We really need this data to be able to let people know this is worth paying attention to. So it's a win-win-win for all of us. Just take this opportunity to have your voice be heard. It'll take about 15 minutes more if you want to tell us more. We'd love to have any information that you want to share or any experiences that you think would be helpful to share with the community. But these will be 15 minutes that are really well spent. And then if I can be so bold, I'm going to ask you to not only complete it, but then share it with any other friends, family that you have within the BFRB community, or in other organizations where individuals with these behaviors might be prevalent. Our goal is to reach 20,000 people, which is a lot of people, but actually we can do it if we work together. So I know that we can make this happen. Thank you so much for your help.